A very good evening, one and all. Today, we are back again with one more live episode of ours with one and only Dr.Srishti Bhatia from the Bhatia Dental Pulse, one of the exceptionally doing well YouTube channel where they have more than 1.5 lakh subscribers and counting. Welcome to our show, Dr. Bhatia.
Hi, it's so good to be here.
We are equally excited for the conversations that I'm looking ahead to. So, can we start with a small introduction of you, Dr. Bhatia, your journey in dentistry, right? If you want to cite some example about how did you land up here and how are we already seeing your practice to be roaring, and so is your YouTube channel.
Yeah, so it's been about 10 years that I'm in this profession. The reason that I'm here is I think my dad, because he's a dentist and therefore he wanted me to follow suit, and I guess that's what led to this. But I chose orthodontics as a passion that I felt for it. If there was one specialty that I wanted to do, that was only ortho. So that is how I became an orthodontist. And as for the clinical practice, yes, we do have a lot of patients that are coming in, especially from the YouTube channel that we are currently running. This started around 2020 or so. It's been about 3 years that we started the channel, and we have about 1.5 lakh subscribers that are there.
So, how did it start, Dr. Bhatia? Because when we see having such a good traction on any social media or YouTube, it is not just the content which is going out there, but understanding of algorithms, being consistent, understanding of what topics is to be chosen and which is posted when. So, tell me about your journey. How did you start it? And was there any special advices that you took from YouTubers about how do you run this, or you learned it by your own?
So very frankly, this started because of COVID. During COVID, all our practices were shut for that time being, and all our patients kept calling in with a lot of queries and cap nikal gaya hai, braces wire chubh raha hai, etc., etc. So we started this channel with the motive that we would try to help out those patients who we are not able to currently see in the practice. So this was basically like you can say a home solution kind of a thing at that point of time. And gradually it got built up with the more frequently asked questions, the things that the patients keep asking over and over again. We wanted to stop repeating them and just give them a video that they can watch at their convenience. For example, when a patient gets an extraction done, it gets very difficult to keep repeating the same instructions over and over again. So now we just forward them the link of the video and we say, go home, watch it, and do not forget to follow the steps. And there it goes.
Wonderful, wonderful. That's how you have been building your organic traction so far.
Yeah, and as for taking help, of course, anybody that we can find is related to the field. We do ask them a lot of questions, how they build their channel, what are they doing about it. We try to gain whatever we can out of it.
Right. So, are you the one who's handling YouTube channel right from making the topics to getting the content copy ready, shooting it, posting it, and making sure that SEO is in place? How does it work?
Both me and my dad are shooting the videos. We are both editing ourselves, and the SEO part I am handling, and the keywords, the organic traction, as you put it. So all of that I am handling.
Oh, wonderful. I have gone across many video of you and your dad. An amazing work. I really must say I appreciate the kind of new age path that dentists like you are doing it, because typically when we see an attitude of any medical or a dental practitioner, it is very, very orthodox in nature. And it takes decades for them to change their mindset as opposed to a professional in other domain or a discipline. So I
So
really
my
must.
dad has been practicing for about 30, 35 years. So I was that change in attitude that you're talking about. So when I came in, it was like we should do something new, something more for the younger generation and everything. So more of his clientele was the older generation, the
Hmm.
people who had been visiting him for so many years and everything. So now the trend has little shifted towards the younger mindset as well.
Wow. Wow. I'm sinking that information in. So, can you tell me what has been a change in target audience or an ideal consumer profile? What you have been receiving in your practice? If you can also go back in time and tell me the exact place where your father started the practice, and are you still on that same place where the clinic is running, or did you change? And then the
So
change of
this
customer profile.
started as a one clinic chair at the point when my dad started it. So now we have 4 chairs, and we have a staff of about 6 people. And generally, I'm not boasting, but generally the clinic is quite full. So the place remains the same, the basic methodology remains the same, the works, the work ethics and everything, all of that remains the same. The only thing that has changed is we've inbuilt a lot of technology now. So we have a OPG machine at the clinic, we have dental laser, we have an intraoral scanner as well. And now this is something which most clinics do not have currently. They might, buy it in the future, but right now it is not available everywhere. And genuinely, the scanner has become such a everyday necessity now that we have it. Not just in terms of prediction, but also in terms of accuracy and everything. It's just so much better to have it.
Absolutely. So you have like completely digitized your practice,
Yeah, completely.
gone paperless.
No manual measurements, no manual cap fittings. Everything is gone digital. Everything is computerized.
Amazing. And do you also tie up and choose the labs which are digitized, right? We cannot work with
Of
undigitized
course.
labs for the same. And as a dental practitioners, I have these questions from a lot of young practitioners that when can you decide what is the right time to upgrade all these instruments and the high-end diagnostics that you have in your clinic? And obviously, to upgrade, you need to have a very good patient flow through which you are making your revenue. And we are aware of the statistics of dentists in India. We have more number of dentists than required. And also when we see at the patient's attitude, a typical common saying is that they are not aware about their oral health to begin with, let alone
Mhm.
coming to a dental clinic to get preventive things. We often see the corrective audience. So if you
Yeah.
can, how can a dental surgeon who's practicing can improvise his practice and can get patients motivated to understand the importance of oral and its impact on overall health?
I think social media right now is very, very powerful, and that is the way to go if you want to actually interact with your audience. Like, those times are gone now that you go to a newspaper vendor in the morning and give your pamphlets and everything, get it distributed. Right now, nobody genuinely reads all advertisements and all of that. But what works for people is a digital market that is there right now. So I think anybody who's trying to make a successful practice should focus on social media promotions and not just, in fact, not just promotion, also dental awareness for that matter. Because once the people are aware that something is wrong, they're going to come back to you.
Right, right. And what do you think, apart from social media, can be a great tools to encourage people to understand their oral health and the basics of, say, oral screening or initial form of pathologies?
Maybe we can, like, for example, schools and colleges are a very good platform for conducting some checkup camps, for example. So those promote health awareness as well, and they do get some patients back to the clinic also. So it's a win-win in both ways. So that kind of a thing can be undertaken. Some social camps, for example, the resident welfare associations organize dental camps at times. The nearby mandirs and gurdwaras also do the same. So that is a thing that can be done.
Right, right, right. So your practice along with your father is in Delhi, right?
Yeah.
And how would you describe a typical patient in your area in the capital of India as opposed to kind of patients that are fellow colleagues and professionals see in other tier 1 cities and tier 2 and below, where again the patient's mentality and mindset is very different? How do you think can those be
So
addressed?
the patients in Delhi do not just target on the corrective thing. I see a lot of patients who want to get preventive treatments as well. Like for kids, fluoride treatment has become very normal now. It's very common, very commonly done. And same with pit and fissure sealants. And say for that matter, in orthodontics as well, people come in with their kids at the age of around 6 to 7 years of age and want a treatment that can correct the deformity beforehand. So I've just finished a case with a Z spring and two central incisors which were blocked by the lower arch. So all of those cases have also started coming in more in the recent years. As it was before, that has already increased to some extent, and I feel this will increase with time. Like
Right.
just like the awareness and everything grows, and I think this should increase.
Well said, Dr. Bhatia. I have seen the same pattern in the thought process of patients, especially after COVID, where people
Mhm.
started adopting preventive and holistic care in all the disciplines. Oral and dental is coming slowly, but as you see, right, in tier 1 cities, we are already seeing that shift of mindset, the paradigm shift that we always wanted to see. I want you to elaborate more on when we talk about this on our channel and in our platform app, when a 6-year-old or a 7-year-old child is made to scan his oral cavity, we can introduce preventive orthodontics, where we do not want all of the malalignment and changes of the jaw structure. We can actually control the growth of, say, jaw and teeth and how are they getting placed. Can you
Right.
more to give this kind of patient awareness and also to our fellow doctors so that they can promote the same?
Again, for this particular thing, schools are very important. Unless you go to that school level and you educate them en masse, it's not possible to go and educate each and every child. And once that child has that prescription that the mouth requires something to be done, they go home with that prescription, talk to their parents about it, and then the parent also becomes aware that something is wrong with the kid. So I think that is the way to go forward with that.
And when they come to you, that they have understood that the growth of teeth or the dental skeletal ratio is not right, what are the typical treatments, the preventive forms of treatments that you operate in your clinic and you would suggest to the
Um, As for the jaw relation is concerned, one thing to be done is generally a twin block appliance or maybe an oral screen appliance if the arch is too narrow or if the patient is a mouth breather. Then in that case, we can do all of those. Twin block works excellent and it's a very good choice if your lower jaw is not positioned in the right direction and it's a little backward as compared to the upper jaw. And things like Z springs are very simple appliances where you can correct the upper incisors so that they are in position and it allows the lower and the upper jaw to grow as it would have if this interference was not there. So this is something which we have to tell the patients even now that this is something which is hampering the growth of your child. And then they finally understand the point and get it done.
right? Wonderful, wonderful. For the same purpose, do you also tie up with local pediatricians so that when
We
parents
have an on-call pediatricians. Yes, we have a family pediatrician, for example, who refers his patients to us in case there's a child that he sees who needs dental care. So he sends them over to us.
Right, right. I want to add a point here. When we spoke to other specialty doctors, especially pediatricians, cardiac specialty cardiologist, and gynecologist, we were shocked to see that so many of them are not referring their patients to a dental professional if they see something is not right. Either they're not able to correlate and connect the impact and the overall effect of the bad bacteria in mouth, causing silent heart attacks or say early delivery in pregnancy, the preterm delivery, or maybe they are too occupied with their own discipline that they tend to forget,
Possibly.
right? So what would you recommend about how can we have such associations with other disciplines where we make a very synergistic atmosphere where they can refer those patients here in order to get a complete care?
I feel CMEs and CDs are the answer to that, but I'm not sure how much people are interested in all of those anymore. Because
Hmm.
personally, I haven't been to one in a while.
How is the situation there in Delhi? Are you not attending
COVID-wise, it's all
PD?
good.
Okay, got it. Yeah. So, a follow-up question to the kind of audience that you have built on YouTube, right? From the oldies who are visiting to your clinic to all the young generations who are coming to you after watching your videos. Why YouTube? I mean, there are a lot of other social medias also, and we know that every platform has its own theme. But we also know that a lot of them are building their careers on Instagram. So, what's your opinion on that?
So Instagram is something which is more recent. When we started, YouTube was a major medium if you wanted to do something like this because since is already about descriptive videos, it was about long videos. It is now about more about shorts, I would feel.
Hmm.
But at that point of time, it was more about long videos and things that would describe your problem and give you solutions. So people actually went on to YouTube when they wanted answers to a particular problem, and that is where we came in. And they wanted answers to why is it paining, what to do about the pain, whatever it is, and we would answer their questions. But Instagram, I feel people tend to scroll through more, and they are not on Instagram to gain a particular answer or gain some knowledge about that subject. They are just there to scroll. That's what I feel. So it is good for those influencers or those people who are actually in travel, fashion, for example. Those kind of people get a lot of audience on Instagram. Maybe it motivates people to travel more or maybe try some beauty hack or something like that.
Hmm.
But we still, most of our patients, even though we are present on Instagram as well, but the following that we have there versus the one that we have on YouTube is a lot different.
Wonderful. So, your focus was YouTube, and it will be YouTube for coming couple of years, if I may say.
That makes sense.
Right. And if you can tell me what is the percentage of total number of patients coming to you via YouTube? So you can just put it them into various buckets. That the one who are coming via YouTube, Google search or Google My Business, and word of mouth.
The word of mouth, I think, still will be about 50%, I would say. And about 30%, 35% will be YouTube. And although the people who are looking us up on YouTube or hearing word of mouth, they both will go on Google and search us out first, read our reviews, and then come in. So that gets intermingled with the other two.
Right, right. Can you share some challenges that you had while learning how do you edit or post? Now we have a lot of editing tools, but when it comes to understanding of the right keywords, the right time to post a particular video of which topic, share your challenges and also three top learnings that you had so that our viewers can benefit.
Yeah, I think we're still learning this because the algorithms keep changing. So you master a particular type of thing and then it suddenly changes and then you have to learn about it all over again. So the keywords and everything we have, there are a few softwares, for example, vidIQ, and there was another one, Keyword Explorer or something. So there are a couple of softwares that we use, and that gives us a basic idea about the keywords. The topics are still based on what we think the patients want to know and the things that the patients keep asking us again and again. That is just based on our insights. That's no particular topic. Also, we do look at some other dental channels, for example, who are doing well and what kind of content they create. So we try to pick up something from them as well.
Good to know that. And what do you believe is the right consistency? Is it like one long video and one short every day, or how do you plan your
We are still experimenting with this kind of thing because at one point of time when there were only shorts all across YouTube, we were putting one short every day. So now we are doing one short and one long video mostly for each day, but sometimes it gets a little misplaced here and there.
But overall, is it
Earlier,
a long
yeah, earlier it used to
video?
be about 1 to 2 long videos per week, and that's about before the shorts thing came in.
Right. And is it the same now? 1 to 2 long videos a week and a couple of
We
them.
are trying to do about 5 to 6 long videos per week and 5 to 6 shorts per week.
Wow. That's a lot of quantity.
Yeah, that's
And
a lot of quantity. We're just experimenting with the numbers right now.
right.
So our channel had a major dip some time back, and the 48 hours views that used to be about 80,000, 90,000 suddenly dipped down to about 8 to 9,000.
Hmm.
So it had happened over like a short course of time, but it suddenly dipped, and there was no explanation, no nothing. This was around the time when shorts were coming in.
Hmm.
So then we started pushing it back up. We started with the shorts and started with the more long videos and everything. So now it is back to about 50, 55,000. It's back up there.
Right, right. No wonder all these updates also, which have been pushed by other platforms in order to correct a lot of faults, like correcting the bots or correcting wrong content or pushing a different form like shorts, is when
Yeah.
we see such dips. And to handle such a large quantity of 5 to 6 long and short videos in a week, which you're experimenting, do you have a team to support now?
It's just me and my dad.
Two of you? Wow, that's really
We've
commanding.
actually tried a lot of people before who've offered to come and edit the videos for us or make the videos entirely. But what happens is those people are not do not have a dental background,
Hmm.
right? So they keep asking us that give us all of this detail, give us pictures, give us everything, and we feel when we have to give you all of that, we just sit down and do it ourselves.
Correct. So, how much of your total time in a week, if you can put it in number of hours, do you
Mhm.
put on this YouTube? Right from writing to shooting, editing, and posting.
Maybe about half an hour a day, so 3.5 hours.
Half an hour a day. That's all.
That's what.
So you've mastered the art of producing quality content along with good quantity, I would
So
say.
what happens is when we are doing patients, we keep recording a little bit here and there, whatever procedures we are doing. So all of that content is there. So only thing remaining is just the editing. So for a short, it will take barely 5 minutes. It does not take more than that.
Wonderful.
And for a longer video, we are trying this concept out that the same procedures that we are portraying in the shorts in 15 seconds, we're trying to build out larger videos out of them as well. So again, we have the content for all of that ready. And it will take about 20, 25 minutes maybe to edit that thing out.
Very smart work. I really must say because a lot of brands that I've seen personally very closely have so many team members and so much of discussion happening and work going on with respect to what should be a theme of that particular week and what kind of copy should come out in what way, and yet we don't see so much of engagement. So I
Then
really
it's disheartening. It
yes,
feels so bad. You put in so much work for it and it doesn't perform well. So that
correct.
is why we quit all the work. And it's like we'll keep doing our work and साथ में जो चल जाए ठीक है, that's okay.
Wonderful, wonderful. I really am also thinking in that. I mean, I didn't imagine it's just two of you handling not just the practice, which is full-time job, but YouTube, which is again a full-time job. So it's like 24 plus 24, 48 hours of things both of you are
Maybe
managing.
1 and 1 make 11, that is why.
Really, really amazing. All right, so thank you so much for sharing your insights with respect to YouTube. I have just a few questions with respect to orthodontist or orthodontic practice, since we have an expert here, Dr. Bhatia, before concluding this particular live. So, Dr. Bhatia, tell me about your opinion with respect to change in people's perspective with respect to, say, teeth straightening options that we have in the country. After a lot of startups have come up with other forms which were not before. So, what is your personal view on that?
See, I just have to say one thing over it, and that is this is something which should be mediated by an orthodontist. There are a lot of options which are available right now, and so many things can be done apart from braces, for example, clear aligners. But the orthodontic mediation should still be there. The orthodontist has studied for 3 years to know how to move the teeth, know where to stop, know what to do about them, and in case something goes wrong, then what to do. So the companies that come and say that we'll do everything at home, for example, they even ask the patient to send impressions on their own. So
Correct.
this is something that as a BDS graduate, we take literally months to master. So I do not understand how a patient can do it on their own on their first attempt. So this is all something where a professional guidance is required and should not be ignored.
Hmm. Have you seen a few patients who went ahead for, say, at-home aligners, and the treatment went wrong, or they
So
didn't
many of them come back with the same thing that we got this done and this does not turn out well. There's nobody that they can talk to now. And then they come back and get the conventional thing done, or maybe aligners at the clinic where they can actually come back and report.
right? As a practicing orthodontist, can you give me a stat of the relapse rate, what we are seeing in both traditional braces and aligners?
The relapse rate is similar. That is not an issue,
Hmm.
provided the patient is wearing retainers. That is questionable in the first place because all the patients want that once they're free with the process, they do not want to wear anything.
Hmm.
So that way, fixed retainers help you out because at least that's protecting the front 60, and that's generally what matters to the patient, most
Right.
commonly. At least.
Right, right. I would like to share one example. The common things that we sometimes, our team of dentists struggle is to make a person or a patient understand if he is an eligible case for aligners or not. As we know, the severity of malocclusion could be mild, moderate, or severe, and some cases can or cannot be solved by aligners. How do you change that mindset of patient if he is firm that I don't want anything but aligners, but as a practicing orthodontist, you think that case is not eligible for one? How do you deal with such things?
So we generally tell them the options that are there. Firstly, for cases that are complex, the aligner prices go considerably higher. So there is a huge cost difference between the aligner if he goes for that option and if he goes for braces. Even
Hmm.
the best of braces will cost him roughly half the amount. So generally that is one big convincing factor for the patient that it is going to be this much of a price difference. Plus when you tell them that the results are not going to be that great and you can expect a little lesser than what you are hoping, then generally they turn around and say that you do what's best,
Hmm.
whatever you think is best.
Right. And can you just give me a heads up total number of teeth straightening in both braces and aligners that you have done at your clinic?
At my clinic, it's been about 500 plus.
Wow. Wow. Amazing. Wonderful. So I think I'm done with all the questions and all the questions that our users had asked with respect to YouTube mainly. Um, uh, um, do you want to add anything as a take-home message for both? So we have both kind of users watching our live sessions. They are users, which are patients, and also dental professionals. So one message for both the parties, one and one, two messages. Yeah.
So see, for the dental professionals, if you want to actually make it work, you should go to social media. That is your take home message. And for the patients or the people that are watching, you should consider all forms of social media for getting all sorts of information. But at the end of the day, it has to be a professional who decides what's best for your teeth. You cannot decide based on what information you receive on the internet, and let the doctor decide what is finally best.
Absolutely. Thank you so much, Dr. Srishti. It was wonderful having you and a very crisp, wonderful to the point chat. I'm sure this particular video will also rank higher, and we'll post it as soon as possible on our channel, and same we will be giving to you. Thank you so much for your time and your insights.
Thank you for having me.